My name is Megan Gao. I'm a family physician in Moose Factory, Ontario. Moose Factory is a town of 2,500 people at the mouth of James Bay, so pretty north in Ontario. We service approximately 12,000 people along the West James Bay coast. Moose Factory and the surrounding communities is predominantly a First Nations community, and most people are Cree speaking. So our hospital has around 37 beds. We generally see around 10 to 15 very acute patients, plus around 10 long-term care patients who are also in hospital with us. The EMR that we use here is Practice Solutions. It's neat because every service uses it, so whether it be the hospitalist service, the emergency department, the coastal communities, everybody uses the same, and we're able to see patient records in that sense and provide better continuity of care. We have around 12 full-time family physicians here. We also have a locum surgeon and locum anesthetist that's always here. The family physicians do a broad spectrum of family medicine. We do the primary care clinics, but we also service the emergency department, the inpatient department, and we go up the coast to provide primary care in the coastal communities as well. And when there are no physicians up the coast, we take telephone calls to cover for their emergencies. A lot of us also do obstetrics, and so we provide obstetrical care in Moose Factory and Moosonee, but also along Fort Albany, Kasheshwan, Pewanak, and Attawapiskat. When residents come here, we try to give them as diverse of an experience as possible. So we try to get them up the coast at least once in their rotation. So this could be in any of the coastal communities I mentioned, and they're usually there for 3 to 4 days, and they're providing primary care. However, sometimes if there's an emergency that comes in, they come in as well, and they get to see these emergencies, and they get to see how limited of resources we have. Otherwise, we try to set them up with 1 or 2 preceptors, main preceptors, and then they do hospital services with them. They do primary care, but they also do emergency medicine. We also, if whoever's interested, we can get them into the OR to do some surgical assist as well. So we try to give them a balanced experience here, but also geared towards what their interests are. The residents usually live in housing that's right across from the hospital, so you don't need to walk very far. It's probably the shortest commute anybody will ever have. You don't have to get up really early, and you can just go straight to work. But I would recommend that everybody bring boots when they come here, rubber boots especially, because it gets really muddy very quickly. We don't have any paved roads. There's no call per se for the residents. If anybody's particularly interested in, say, obstetrics, then they can offer to cover call, but they will always have support. We're always going to be there with them. But if they want to, that's something they can do, but it's not mandatory. When you're a hospitalist service, you are covering the service essentially from 8 a.m. to 8 p.m. Generally, you don't have to stay in the hospital for that entire duration, but you do have to cover any calls that the nurses would have until 8 p.m. There is no overnight emergency shifts unless somebody is particularly interested. We just find that the volume is not as high as in the daytime, so it's not as good as a learning experience. So there's really no call. It's really geared towards what people want to do and how much they want to do. So we try to make it as fun as possible for them to be up here. It is quite remote. You're removed from families and friends. We don't really have any coffee shops that they can go to or movie theaters that they can hang out. So essentially a lot of the preceptors, we open our doors to the residents, and so we're essentially the coffee house, or we host movie nights for them. We do a lot of outdoors activities as well. We're surrounded by water, so in the summertime we take them on boating trips, fishing trips, and there's actually people who are hosting, bird watching trips if anybody's interested. In the wintertime, that's when the town becomes more livelier, because we're able to go across the frozen rivers, go to the different islands, snowshoeing, cross-country skiing, and every now and then we do have ice rinks that are on the frozen river as well. And one of the highlights a lot of people say is going to the dump to see the bears, which happens usually in the summertime and fall. But not just that, we also take them to the dump to go shooting, target shooting. which they find very interesting. Because our community is predominantly Cree speaking and First Nations, we try to engage the learners in cultural competency. So in the beginning of their rotation, we usually set them up with a traditional house session with one of our traditional healers. And it's just to go through what traditional healing means and then how they can incorporate that into their practice to better understand the patients. Of course, cultural competency is something that we have to learn lifelong, but it's about opening yourself up and then talking with the community members as much as possible. Come to Moose Factory. It's an exciting place to live and also practice medicine. It's definitely an eye-opening experience.